Good morning. Welcome to Anne Arundel County's first town hall on coronavirus. I'm Roz Hamlet, PIO. With us today are the County Executive Stuart Pittman, our County Health Officer, Dr. Nilesh Kalyanaraman, our School Superintendent, Dr. George Arlotto, and our new Deputy Director of the Office of Emergency Management, Preeti Imrit. We will begin today with statements from our leadership team. We're then going to begin our Q&A, and following the Q&A, we're going to enter into a Q&A period. It is our collective goal this morning to answer as many of your questions as we can. Our goal is to provide you with the latest information so that you can have the highest level of assurance that the county is working very hard to provide you with information that you can use to help keep your family and your loved ones safe. The county is all hands on deck. So this morning, we are live streaming on Facebook, as well as broadcasting on cable access channels 38 Verizon and 98 Comcast. This program is also being recorded and will be available later on YouTube. Let us begin with a statement from the county executive.
Thank you, Roz. Yes, welcome to the first weekly virtual town hall on COVID-19. I spend, as county executive, most of the week working with our departments, and this last week has been really about trying to keep government going, making sure that we do the social distancing that we need to do to prevent the spread of this virus, but at the same time provide services to the residents of Anne Arundel County during a time of great need. The first question I really want to answer is, why the big deal? This all came across pretty suddenly, and a week ago, if you had told me that our schools would be closed and that most of our staff would be working from home, I would have been a little bit shocked and surprised, and I know that that's the response that a lot of people have had. I know that there's also been fear and worry, and the purpose of the town hall is really to allow my staff, the people that are on the front lines working on this, to speak directly to you. And each week we'll have different people coming in, talking about different aspects of this. We may have federal government, state government as well participating. But more important than that, it's an opportunity for us to hear from you about your plans, your fears, your challenges, whether you're in a business or whether it's your family or whatever part of the county you're from and whatever you're dealing with. I think it's absolutely essential that we communicate as best we can. The first case in our county was Wednesday that we know of that tested positive. Then on Thursday, the governor made an announcement closing schools as well as closing senior centers, as well as preventing gatherings of more than 250 people from happening. Did that with a state of emergency order. We in the county had already been planning for this, of course, and on Wednesday, when the announcement came of our first case, we had a cabinet meeting of all the department heads that took place right here at our Emergency Operations Center in Glen Burnie, and that was an exercise where we talked about scenarios and how the county would respond as this virus spreads in our county, as we know it will. Why do we know that it will? This is a question that I watch what people are looking at on the internet, and you hear things in the news, and there are still people saying, well, a lot more people die of cancer, a lot more people die of gun violence, automobile accidents than have died from COVID-19. And that's true. But the scientists, who we really should be listening to and we really should trust, can see what's coming. They've seen it spread in other counties, and they know that in our county, in our state, there are a lot more people that are positive than have shown up on tests. So I want to say something briefly about testing because I think it's changing fast, and I know our health officer will have more to say about this. But I think the governor was misunderstood when he said that we're moved on from testing and we're dealing with the urgent things that we can do right now. In fact, the landscape is changing fast on testing, and that's a good thing. We've only had about 100 people tested in the state of Maryland. They're no longer reporting the numbers of tests that are being done through the state, but we've had good news come in very recently. Johns Hopkins is doing their own test, and they're saying that they will be able to get up to the point of doing 1,000 tests a day very soon. And then just last night, I heard that one of the Roche, one of the companies that has a test, is got 400,000 kits ready to go and is going to be getting up into the millions very quickly with production. So it's important to know who has the virus in order to be able to track who has been in contact with people who have the virus, so that we can plan and isolate people and quarantine people more effectively to slow the spread of the virus. Why is it important to slow the spread of the virus? The estimates are that somewhere between 50 and 80% of our population will get the virus eventually, and the challenge is really being able to treat the people who have the virus and get sick. We know that it's mostly the elderly and people who are vulnerable in other ways because of health conditions that they have that are most likely to get very sick from this with pneumonia and possibly die. The mortality rate, they're saying, for this virus is in the 2% to 3% range. You can do your own math, but if you do your own math, you will see that Anne Arundel County and the state of Maryland are going to have a challenge in our hospitals treating the people that get this virus and become very sick. So by slowing the spread of the virus, we reduce the numbers of people going into our emergency rooms and going into our hospitals. And as we've seen in other countries, that's the biggest challenge. When you have more people who are sick than our health system is able to treat. So that's why it's absolutely essential that we take seriously all of the recommendations on social distancing to prevent the spread of this virus. And most importantly, anybody who has any symptoms of the virus, whether it's cough, fever, cold, to separate themselves as much as possible from other folks. So what is Anne Arundel County doing? That's what we have daily calls about with all our department heads. We have a team in our office that is monitoring everything and making changes as we go. I just signed a state of emergency order for the county yesterday, and I'll tell you why we had to do that. The state of emergency is basically to cut through red tape, because at a time like this, we need to be able to make decisions that our county charter does not allow us to make quickly, such as when we have employees who call in sick, we need to be able to waive the requirement that they have a doctor's note. We don't want to send everybody into a doctor to be told that they have the symptoms of COVID-19. We need to be able to pay people, employees and contract workers, who are staying home rather than have them pressured to come into work. So we need to make some changes for that. We've declared the state of emergency. Our personnel folks are working on new guidelines for home telework. Our IT office is doing a lot of work to increase the number of licenses that we have to use software to allow us to have virtual meetings. Making it possible for people to work at home is absolutely essential. And in our office, we have identified the people who will be working at home and the people who will be coming to the office, switching so that people don't infect one another if somebody becomes positive. Throughout the county government, you've probably already heard most of this, but I'm going to make a few announcements that may be new that I just heard yesterday from our conference call. In our sheriff's office, we will not be enforcing eviction notices during this time. Non-essential judicial functions are suspended. Within our police department, we need to keep our officers from getting infected because they're going to be on the front lines of this. And so the daily roll call at the beginning of each shift is now being done virtually. There's less interaction between supervisors and police. That's going to be done by telephone as much as possible. there's going to be less interaction directly between the police officers and the community when it's possible to handle things via telephone and online. Our detention facilities, no visitors allowed during this time. We have 2 isolation units, one at the Jennifer Road and one at Ordnance Road detention centers, where inmates can be moved to if they test positive. None have so far. Workforce development, career centers are closed to the general public, but are going to still be operating by appointment only. Public Works has suspended all water service shutoffs indefinitely. When people can't pay their bill, now is not a time to shut them off. There's going to be increased coordination with the City of Annapolis, Department of Public Works, and the county for mutual aid at water plant and roads. The coordination between the City of Annapolis and Anne Arundel County has been stepped up. We had a joint exercise together here at Emergency Operations, and all county departments and city departments are coordinating their efforts as well. Our parks, Rec and Parks, has suspended indoor and outdoor use of school facilities and senior centers where we have recreation activities, closed our pools and rec centers, communicated with athletic associations to cancel their practices. All turf fields are closed. Child care programs that are run through Rec and Parks are closed while the schools are closed. Parks, however, remain open, and they and I are encouraging people to get outside, enjoy our parks, go out there and breathe some fresh air and stay healthy. Our housing authority is not doing evictions, although they say that they are rare, and they're doing social distancing as well in our public housing. Mental health, the mobile crisis teams are still operating but using discretion and phone consultations wherever possible. We have our school superintendent here to talk about the great work that our schools are doing. He's here because Monday is the first day of the closures, and he's also going to talk about the meals that we're providing to kids at 52 locations around the county that we're going to continue doing. Inspections and permits are being issued by appointment only rather than foot traffic into the office. Plan review is happening remotely, and permits for events through April 30th have been rescinded, the public events. Libraries are closed until March 30th, and the list goes on and on. Every single day, we're getting new information from our departments. All of them have continuation of operations plans underway so that as people become ill, they are able to continue operating. It's absolutely essential at this time that we continue government operations as much as we can. So I would just end by saying that get outdoors, enjoy the spring, create family time, talk to your kids. My kids are worried about some of this and worried about their grandmother, and I think a lot of kids are, and we need to talk. We need to spend some quality time together. So I'm going to pass it on to Preeti Emmerich, who is the Deputy Director here at the Emergency Operations Center. Thank you.
Thank you. Good morning. My name is Preeti Emmerich. I'm the Deputy Director of the Office of Emergency Management. The Office of Emergency Management has been working diligently even before January, when news of the coronavirus first broke out. As County Executive Pittman has stated, we've been working with numerous stakeholders, local, state, and region, in order to be prepared and to respond to COVID-19. And part of that has been plan review, developing exercises and trainings, and also working with the state on resource request. We want to make sure that our local partners, the hospitals, even our local agencies within Anne Arundel County have the resources to be prepared. In coordination with that, we're also working very closely with the Annapolis City Office of Emergency Management. As was stated, we did have a joint exercise with them, and we're making sure that we're working hand in hand with Annapolis City in order to coordinate our preparedness and response. As a former emergency manager of a hospital system, it is near and dear to me that we coordinate with the hospitals and to make sure that we understand their operations and their plans. And we've been doing that and keeping in close contact with Anne Arundel Medical Center and with Baltimore Washington. At this time, our Emergency Operations Center is at an enhanced activation level. As the need necessitates, we could always move up to a higher level of activation. And again, as the county executive has stated, we are working with our local agencies to make sure that continuity of operations is continuing, as that is key in order to serve our citizens of Anne Arundel County. We enjoy a very close relationship with the Maryland Emergency Management Agency. We're in close coordination with them during conference calls, and of course with the resource request process. The Maryland Emergency Management Agency is at a full activation level, and we're utilizing the resource request system that they have in place in order, again, to make sure that our county is prepared. Next, I'd like to turn this over to Dr. Nilesh Kalyana-Raman, our health officer.
Thank you, Preeti. I wanted to give you a little bit of information about COVID-19, what it is that we're looking at, and what it is that you can do about it. So COVID-19 is a virus. It's related to the viruses that cause the common cold, but it's much, much more dangerous to our population. As the county executive mentioned, the death rates are somewhere in the 2 to 3% range. And that's much higher than what we see for the flu, which ranges somewhere from 0.01 to 0.1%. And so that's why there's a lot of talk about this. That's why we're taking action about this. Now, the COVID-19 disease, the symptoms are pretty common cold and flu symptoms. They're shortness of breath, fever, cough, and sore throat. And what we know is that those symptoms are very similar to other symptoms that you have from cold and flu. And so what we're asking you to do is to take a few steps to try to stay safe and try to be mindful that because this is a new disease and is much more dangerous, that you want to stay home when you are sick, whether that's staying home from work or from other activities where there are other people. Most of the time we push through if they're mild, and I think it's really important to make sure that you don't, that you stay home or stay where you are and stay as much as you can, keep your distance from others who are around you. That you make sure that you, in general, even whether you're sick or not, wash your hands frequently or use hand sanitizer. And we recommend soap and water as much as possible because there's shortages of hand sanitizer. Soap works just as well, and there are no shortages. If you do have a cough or sneeze, cover them into the crook of your arm. And make sure that you're disinfecting and cleaning down surfaces that are touched frequently. One of the recommendations we also have is to try to avoid touching your face as much as possible. It's hard. You'll notice us do that multiple times today during this Facebook Live event. But the more we talk about it, the more we become aware of it and try to slow it down and decrease the number of times that it happens. So why are we talking about this now? There's only a handful of cases. We're probably close to about 20 in Maryland. And as the county executive noted, our first case in Maryland was just last Friday, 8 days ago. The reason is that we know from the experience of other countries, other states in the US, other counties, that if we don't take action now, in a week, in 2 weeks, we will be in a much worse place. That has happened in every single county, state, and country that has not taken action. And so it's really imperative that we take action now and take fairly significant actions as we are and as we are continuing to escalate them. The idea here is that if everybody is getting sick at once, our healthcare system cannot handle that. It's not built for everybody to be sick at once. And so by taking the actions of social distancing, and you've heard that term many times, by taking those actions, we're able to slow down the spread of this disease. social distancing is very hard to do. We are all social creatures. We like to hug, we like to shake hands, we like to meet up with friends and family. But those are the exact things that speed up the transmission of COVID-19. And so it's challenging for all of us, for myself, for you, to figure out how much can I change? And yet that's really what has to happen. There isn't a vaccine, there isn't a treatment at this time. The actions that are going to save us are the actions that each of us takes individually. And so that means teleworking when you can. That means being able to have distance between people, and we recommend 6 feet, but certainly as much as is possible. That means avoiding that handshake, avoiding that hug. And that's hard to do, but those are the things, and each one of those steps builds up and increases our chances of spreading this disease out. We've been collaborating with our county agencies, with city agencies, but also with our healthcare providers, both the behavioral health and the medical community in Anne Arundel County, with our hospitals, to make sure that we have the resources that we need in place to be able to handle this influx of need. We're seeing more and more folks getting sick, needing testing. We're seeing more and more issues around mental health and anxiety. Know that we're here. We have a warm line that you can call, and our hours are posted on our website. Our phone number is 410-222-7256. And we'll be talking more about these issues. So I'm going to turn it over to Dr. Arlotto, our school superintendent at this time.
Thank you and good morning. Again, I'm George Arlotto, the superintendent of Anne Arundel County Public Schools, and was delighted to get the invitation last night to join this event this morning to put some more information out about the schools and our community. Clearly, we are living in an extraordinary time here in our county, our community, and around the country and world. And so we are all making adjustments. We're making adjustments personally at home with our families and our loved ones. We're making adjustments at work. We're making adjustments in our routines and our schedules. And so that is certainly true of our school system and for our 85,000 students and some 12,000 employees. We have been working alongside our county and city officials, along with the Department of Health, very closely and very carefully over the last several weeks. And as you know, we have made announcements in each and every day, and as our county executive alluded to earlier in his remarks, things are changing and they are changing rapidly. I certainly would not 72 hours ago guessed that our schools would be closed, not just in Anne Arundel County, but across the state, and now that's happening across the country. So we are adjusting and adjusting as best we can, and we're adjusting, we're building this plane as we fly it. We are very thankful for that continued partnership and the organization of county government. So thank you for continuing to include us as a school system, but we thank you for your leadership. It has been imperative. Know that AACPS, our public schools, are planned, and we are ready to meet this challenge. We have been planning for the worst and hope that we would not have to begin to implement some of these plans, but here we are. So again, we are ready to meet the challenge. We are ready and prepared to implement continuity of our operations with the school system. Specifically, in some of those areas, our schools and our central office and satellite offices will be closed. They'll be closed to the public. We'll have cleaning teams, cleaning crews in our buildings and satellite locations over the next 2 weeks. That work has already begun. Our central office will be closed to the public, but we will have essential staff coming and going from the central office, me included as necessary, to keep the continuity of operations going. I know that there have been many questions and continue to raise, and we will hear some of them this morning, I'm sure. But two in particular, one our county executive alluded to, is meals. It is imperative that we feel it's imperative that we continue to supply meals, not only to our most needy students, but to all of our students. So with that in mind, as has been mentioned and is on our website, we'll have 52 locations as of now that have been identified and approved by both the federal and state levels for us to continue to get meals to our students. We will have hot meals, a hot lunch and snack that students can pick up at 52 sites. 31 of those sites are at school sites where it will be curbside pickup. The staffs will be in the building cooking and preparing those meals and boxing them up and bringing them out curbside so families, students can pick them up there. We'll have 21 additional mobile sites around the county. And many of our students and families have taken advantage of those over the summer. So many of those sites are the same that you would be used to finding meals during the summer months. We're prepared right now to prepare and deliver roughly 13,000 meals a day over the next 2 weeks. And so our team and our Food Nutrition Services staff has been planning for this, and they are ready to move. If necessary, if the need is there, we're prepared to increase those meals or shift them to sites that are being utilized, fully utilized or underutilized. And so that is in the works as well. Certainly the other big question is, how will we keep our students academically engaged? That work we've been planning for, and our site will go live on Sunday night for students and parents to access. We want our students to enjoy what is now their spring break. So we want our students and families to, as our county executive has said, to spend some time together, some quality time together, get outdoors where you can, and spend some time together. But we also want our students to keep their thinking skills sharp. We want them to engage a few hours each day on the opportunities that we've created for them. What I want to make very clear is what is not expected. These are not lessons that will be graded. These are not lessons that are required for students. These are ways to engage students in skills and information that they've already learned, and to practice those over time. So at the elementary and middle school levels, we've prepared supplemental and enhancements for them in targeted lessons and activities in math and language arts, as well as some access to science and social studies exploration materials. These will be accessible via AACPS TV, as well as online links from our web page, and you'll see that there's already a link built on the front of our web page called e-learning, and that will go live on Sunday evening. We've got a team of folks that are working with these lessons. We're also now preparing for the possibility that we will be out longer than 2 weeks and what some of that instruction will look like into the future. This team will also update things as we go through the next 2 weeks. We expanded the number of library books our students could take home with them, and we encouraged them to take books home with them, our elementary school students, over the course of the next 2 weeks before they left school yesterday, and we handed each of our middle schoolers a novel to begin reading over the course of the next 2 weeks. All of our students also have full access to their normal, regularly accessed online learning, which is part of our class link, and they know how to sign on to that. Included in that is First in Math, very popular with many of our elementary school students, where they can continue to practice and hone their math skills. The high schools is a little different. The high schools, each high school teacher goes about it a little bit differently, so we're asking our high schoolers to focus on their syllabi and keeping up with the work that's already been assigned, their readings and projects and essays that they've already begun working on. Many of the teachers have already built and have been utilizing Blackboard sites and Google Classroom sites, and our high school students should continue to do that, access those, and continue to move forward with their work as their teachers share with them yesterday. And we also have built a parent frequently asked question page as part of that e-links, so parents know how they can engage as well. We're ready. We are in extraordinary times, and so, as I said, we're building this plane as we fly it. We'll have staff that'll be working on various lessons and engagement as needed as we go through this process, but know that things are changing, and we will work to adapt as things change. Thank you.
Thank you, Dr. Arlotto. We've received so many questions probably more in the testing for COVID-19 area. We received so many questions there. So let's start with something basic. I have symptoms and would like to be tested. Can you advise on who I can contact or where I can go to be tested?
This is the question that comes up the most for us as well. The challenge, as you know, is that there aren't enough tests in the United States. We don't have the number of tests anywhere that we need to be able to test everybody who comes into the healthcare system with symptoms, and that's true both throughout the nation, in Maryland, and in our county. And so because of that, we are prioritizing tests for initially those who are in the hospital or who with severe symptoms. And that means that at this present moment, if you have mild symptoms, we actually ask that you stay home and that you avoid getting tested at this time so that we can save them for those who are more ill. Now, if your symptoms are moderate or severe, you're having trouble and you need to go get care, please do that by all means. But if you're able to manage where you are, save those tests for somebody who's in much worse condition.
If someone is feeling sick, at what point should they head to the emergency room?
So if the symptoms of cough, and fever, if you can manage them at home, then that's okay. If your fevers are persisting for more than about 48 to 72 hours, you should certainly seek medical care. If you're having shortness of breath, either new or worsening if you already have it, then you should certainly seek medical care.
Depending on the results of more virus testing, there's a possibility we may need to extend the school closure. When should we expect to hear that schools will either definitely reopen on March 28th or be closed for an additional period of time?
So the short answer to that question is we don't know yet. This was, the closure of school was established by the state superintendent of schools. So we will wait and see. Right now we are planning for the reopening of school on the 30th, and this will be a 2-week break. But certainly we know that could change. There are a number of school systems around the area that have already announced that they'll be closed longer than 2 weeks. But it is a decision to reopen that will be made by the state superintendent of schools. All 24 jurisdictions in the state of Maryland, each of the superintendents have been in close contact. We had a conference call yesterday afternoon to make sure that we are all talking about these kinds of questions and others, as well as sharing best practices and how we're managing our school systems. Likewise, we will be meeting via conference call with the state superintendent on Monday afternoon, and we'll remain in close contact with her. As soon as we know that there's a possible change of schedule, we'll let our community know.
Continuing on in the area of health concerns, we were repeatedly told to use hand sanitizer, but it's not readily available. Governor Cuomo is having hand sanitizer made by the state of New York, and he's distributing it. Can something like that be done in Maryland?
I don't know about manufacturing processes, so what I can tell you is that the more you use soap and water when you have it, the less your need for hand sanitizer is, the less contact you make, so avoiding those handshakes, avoiding those hugs, the less you need it. And wiping down surfaces with disinfecting wipes or similar products, the less you need hand sanitizer. So if you can take those steps to minimize your need for it, that'll help conserve it for when we really truly do need it.
Okay, thank you. Is there a window of time to be tested? Could I start having symptoms, be tested, and have negative results, but if I wait a few days, would it show positive?
So generally, we expect that if you're having symptoms and you truly do have COVID-19, that your test should be positive. With any test, there are some instances where somebody has the disease and the test isn't positive. That happens. That's true of every test that's there. But by and large, if you have symptoms and the disease, we expect that you would show positive.
Will the health department provide a hotline for people, a place where people can call with additional questions?
Yes, so we have a warm line set up that has been we stood it up this week, and the number is 410-222-7256, and it's operating between 7:30 in the morning and 10:30 in the evening from Monday through Friday, and from 10 o'clock in the morning to 4 in the afternoon on Saturday and Sunday. And we are prepared to answer any questions. If you have specific medical concerns, we ask that you contact your doctor, but we're also happy to try to help direct you there as needed.
I would add to that we're providing links everywhere we can to the most important information, but if you just simply went to aacounty.org, there's a banner across every page of the website that takes you to the health department website and the Q&As, as well as the closures. So we have a list of all of the closures that we know about, including the list of all of the things I mentioned earlier about county services that are not operating.
Thank you. What is our best advice for going to restaurants?
So the advice for restaurants is generally the same as it is for others. And this is the challenge of social distancing. You know, the ask is that we try to minimize as many contacts as possible. And the reason for that is that each one that we have just very slightly increases our risk. And so I would ask that you think about, 1, what's the reason for going to the restaurant? 2, how often you're going? And then 3, can you maintain distancing between tables? Our ask is to any of our businesses to do their best to increase the distance between people who are engaging in your business. And so for restaurants, that's moving tables away from each other to create greater space, creating greater spaces for your aisles so that people can move through. And really trying to create a changed social environment where we're coming into contact with each other a little bit less, which is awkward, but what is necessary for this disease.
I want to add something on the restaurants, because now we're talking about the impact on local businesses, small businesses, and they're going to be hit hard, and their employees are going to be hit very hard. Many of their employees are paid hourly, paid with tips. The federal government, the House passed a bill that the Senate is going to be looking at that could be helpful to try to get some resources, more unemployment assistance, and just expanding the safety net in the county. We're also focused on that. We understand that the hardest hit is going to be on the people at the lowest end of the economic scale. And so all of our health and human service agencies are working on plans to address as much of that as we possibly can. I heard a great suggestion from somebody who works in a restaurant, which is that if you don't go to the restaurant, maybe buy a gift card for somebody at the restaurant and then give it to somebody or get it for yourself, so that when this is over, you've already got your restaurant paid for and the restaurant gets the money now. So go buy some gift cards for restaurants.
And the other suggestion is takeout or delivery. We see that we're hearing more restaurants are doing takeout and delivery and have an uptick in that. So you can still get the business to them, still get the food, but minimize the contact.
Great. Following up on something you said, County Executive, here's a question about guidance in the area of health and race equity. In order to avoid the problems that occurred during Katrina, what guidance has the county given to social service and healthcare providers to ensure that services and resources are equitably distributed?
So we have our partnership for children, youth, and families that I just got an email from actually today, where their staff had met and where they're really looking at all the other agencies and all the other services to make sure that underserved communities are served, whether there are niches that we need to move into that have not been served through this. As I said, economically, the people at the bottom end are going to be the ones that are the hardest hit. I mean, imagine when your kids are home from school, you're in an hourly job, you don't have a way to get daycare or money to get daycare, and you have to stay home and forego all of your income. That's going to hit communities predominantly, by race as well, because income and race are linked. But that's got to be our focus. I think the safety net is not strong, and as we were having our budget meetings just this week, we were looking at the possibility that we need to create some emergency funds to help. But we have not made specific plans for how to do that. We know that we have a lot of work to do in that area. It's going to be our biggest challenge.
Here's a question from a woman who is over 60 and she doesn't have a primary care physician. She wants to know, would she go to patient first or urgent care type place if the need arises to be tested?
If the need arises, that's an option. We know that this is what the urgent care centers are for, but we also know that they too are being overwhelmed by this. And so I would suggest that for an urgent care type center, that you actually call ahead to make sure that they can take you before you go. And if you're not able to succeed with that, we suggest calling our warm line so that we can help you figure out what you need to do next.
Here's a question from someone who lives in South County. If I live in a district where there is no nearby public health center, is there a plan for residents to get testing and other needed supplies at nearby area schools?
So as I mentioned earlier, we're not advocating for broad scale testing at this point because we don't have the tests to be able to do that. The tests are going to be done in the context of care. And so those have to be done, at present moment, they have to be done by healthcare providers. And there are healthcare providers in South County who are able to handle these needs at this time.
Bay Community Health in Owensville is the federally qualified health clinic that people can contact.
Mm-hmm.
Here's a question regarding closures and cancellations. Is it possible to order private business closed with limited exceptions? Grocery stores, pharmacies, gathering in restaurants, casinos, recreation activities is a concern.
It is possible under certain circumstances, and that's why the emergency declaration was made by the governor to make that possible.
Very good. Let's move to the area of unemployment. Are there any measures in place to help hourly workers affected by all of the COVID-19 closures? Can we get a little more specific there?
It's about helping
Hourly
wage
workers.
Yeah, I mean, I think we addressed that as best we could. We're hoping that through the federal government, that's where that aid comes from. If the bill that the House passed goes to the Senate, that's going to be helpful and gets passed there as well, an emergency aid package. But if they work for the county, then even contract workers, we're working right now with our Office of Law to make it possible to pay those folks. But if they're privately employed, of course, we encourage the business owners to provide all the compensation that they can, but we understand that they're going to be in trouble as well, and sometimes the money just doesn't exist. So that's where government needs to come in and help. But we are looking at the possibility of assisting at the county level in our budget.
This next question is a question from an employee of Fort Meade, which is following the Department of Defense's current policy of business as usual. Everyone report in person. What are county officials doing to lean on them to make a better decision?
We're not doing anything specifically to lean on Fort Meade and the federal government on that. They have the same directives from the state that everybody else does. And, we're encouraging them, like everybody, to do social distancing and teleworking.
Kiddo? As has become evident, and we're moving back to testing again. As has become evident, asymptomatic residents of Anne Arundel County can be silent carriers of the coronavirus strands that are infecting an exponentially growing number of people. Will the county commit to get every resident, symptomatic and asymptomatic, tested, preferably at no cost, to give everyone a definitive diagnosis and plan moving forward?
So the things that we're talking about in terms of social distancing, that's really what's going to be effective. Testing everybody really isn't going to change what it is that we know we need to do. We will certainly, if we tested a lot more people, we would have a better idea of the spread. We would have a better idea of who needs to be able to isolate and or quarantine. And the difference between those two, by the way, is isolation is if you have symptoms, quarantine is if you don't. But we know that situations are changing, and so while you may test one way today, certainly if you test negative today, in a few days you might not, you might be positive. And so there really isn't a good reason to do widespread testing like that. Taking these measures, the social distancing measures, are the ones that are going to help, and getting tests for those who are symptomatic is really our goal.
Following up on distancing, with signing the executive order, Preeti, perhaps you can address this. With signing the executive order declaring a civil emergency, what would be the deciding factor in mandating a curfew?
Well, as the county executive had stated, with the local and even with the state, there are certain things that it frees up the county executive to do. It would be in the trigger factor of this situation, there wouldn't be a need for curfew, so it would be as the situation evolves, and it's very situation dependent.
Experts say that we need 2 to 3 weeks of supplies on hand in case of a quarantine. Will there be enough notice about a quarantine or isolation to get and or replenish supplies?
So one of the things that we're really keyed in on is making sure that we understand the situation that's occurring. So understanding what the disease spread is, taking these actions. The more we're able to suppress virus spread now, the less likely such a situation is. And that's why we're taking such strong measures so quickly into the course of spread in Maryland.
And in terms of supplies, the state is furiously working to get supplies. And our central services has purchasers that have been on the telephone actively working to get supplies to come into the county government. And we're not the only ones out there doing the same thing, so it's a challenge.
Here's a worst case scenario question. What plans are in place for the hospitals and urgent care facilities if we see an increase in COVID-19 cases that overwhelms our public health system? Do we have a plan?
So those are, in such a situation, that's when we have disaster plans that are meant for that type of situation where our healthcare system can't manage. And hospitals and government have those disaster plans, and if we needed to invoke them, we would. We're trying not to get to that point. That is the goal.
As a former hospital emergency manager, and especially working with our Anne Arundel County hospitals, they're always preparing for this. So even in a time where we don't have something like COVID-19, they're continually planning, exercising, and training for the potential that this might happen. So in terms of the disaster plans, they're already in place, already been exercised and trained on, and in a situation like this, they're ready to go.
With social distancing going on and people living in under isolated circumstances, let's turn to mental health. For outpatient behavioral health facilities that hold group therapy sessions, the group rooms do not allow for 6 feet of space between members. How are we supposed to handle this when our clients still need to receive services and not all of them have access to the internet to make teletherapy an option?
That's a great question. Actually, this Tuesday at 9 o'clock, we're having a call for behavioral health providers in the county to be able to address questions like this. and to understand what are the challenges that are being faced by our providers, and to be able to provide guidance on how to manage this type of situation. As I was saying earlier, our goal is to do as much as we can. If you can't get to 6 feet, if you can get to 4 or 5 feet, that's better than having 2 chairs right next to each other, right? And so it's looking at how you can maximize these kind of efforts. Another thing that we're going to be doing in the health department this week is to put out some additional guidance on social distancing, and also to provide support to members in the community to help figure these questions out. These are hard questions. We're all struggling with them. And so we're going to be putting out more guidance and assistance for that.
Let's look to the successful resolution of this immediate crisis. After this is over, many people in the community are likely to be suffering from a loss of income during this period and have difficulty paying their bills and buying essentials in the aftermath. What can be done at the county level in coordination with the state and the federal government to provide relief for these individuals?
Well, I mean, the economic hit is huge already, and the stock market has taken its dive and probably be the first thing to come back. But the stock market coming back doesn't get necessarily to families as it's needed, and I mean, not to push the responsibility up the ladder completely, but the federal government has the power to impact the economy in ways that local governments don't. And I know that those are the conversations that are going on right now. And my hope is that people will set aside their political differences and their party differences and cooperate to do the right thing to restore the economy, whether that's whether that's with direct aid to families through tax structures and tax credits, or whether it's broader things that impact the overall economy. But at the local level, I think while we don't have all the answers, my job is to trust the experts. I think all of our job is to trust each other, trust the scientists, to some degree, trust government in ways that we may not, particularly local government, to do the right thing and to trust the experts. And so in the economic arena, we've got people who can give good advice on that. And while I don't have answers of what the county can do right now, you can bet that that I'm looking for them and looking very hard. And so our folks in economic development are listening to the business community about where the needs are greatest and where we can have the greatest impact. And we have to look at how best to use our tax dollars to pull ourselves out of this crisis when we get to that point, and to deal with it now.
This next question I'm very interested to ask because it's a science-based question. Is it possible to get the virus more than once?
It's a good question. We actually don't know the answer to that because it's so new. This originated in China and was first made aware to the broader public in mid-December. So we're 3 months into a global pandemic at this point, and it's probably only China that has the experience to even know the answer to that question. So I think it's a great question. We just don't know yet.
How is contract tracing and communication being done within the county to reduce the spread?
So contact tracing is done by talking to the person, and the health department, we work in close coordination with the State Department of Health. When there is somebody identified who either has the disease or has been exposed to it, we talk to them, and we take a pretty extensive history of who they were in contact with, people, and also businesses, schools, work, that kind of thing, and also how close that contact was. And then those close contacts, we contact them to see if see if they have any symptoms. And if they do, that continues outward. We are only doing that for, we've been doing that for the past few weeks, actually more than that, when there was a travel-related guidelines. But that's going to come to a stop soon. As the virus spreads enough throughout the population, contact tracing just becomes less feasible, and we shift our focus to how do we slow down its rate and how do we take care of people.
So many people are going online and looking to order things there, and they are finding that the prices are just astronomical. Do we have a plan to deal with price gouging? Bad actors showing up and buying all the sanitizer, masks, wipes, and then trying to resell them at horrendous prices, keeping these items from the public and medical professionals who really need them. Is there anything we can do about that?
I mean, right now at the county level, it's simply to discourage it. But people are want to profit off of this crisis. There are going to be people who are going to do that, and that's a sad thing. It's unfortunate, and my hope is that, you know, through the federal emergency order, that they look at that, follow it closely, and if they have to do some price controls, that they will do so.
Do we anticipate any need to close the airport?
I hope not, but it's not a county decision, even though the airport is in the county. It's a state airport, and I suppose the FAA also would be the ones making that decision as well.
Can we talk a little bit more about closures and cancellations and activation and EOC and what all that means?
Sure. So currently, the Emergency Operations Center is at an enhanced activation level. So there are 4 activation levels. Normal day-to-day is the normal operations. The next step is enhanced. Step after that is partial. So with partial activations, we've called key agency stakeholders and other external stakeholders into our EOC, where we're recording this, in order to enhance our coordination and communication internally and externally. Full activation is when all the key stakeholders are present in our Emergency Operations Center. With the local declaration, that does activate our local response and recovery plan. But even before the local declaration was put into effect, we were activated at the enhanced level. With the Emergency Operations Center, we have the flexibility to increase our activation levels in response to the situation and how quickly it evolves. So the Office of Emergency Management, along with county government, state, federal government, obviously, is keeping a close eye on when we need to go to that next level.
Great, thank you. We have been receiving questions via Facebook. And Dr. K, would you go over again, please, the way that people can contact the health department if they have follow-up questions to this town hall and just in general?
Sure. So our website is aahealth.org, and we have a list of resources that you can read through that help understand what this is, what steps you can take, what you can look for. We also have our warm line, and the number for that is 410-222-7256, and that's in operation Mondays through Friday from 7:30 in the morning to 10:30 at night, and then on Saturday and Sunday from 10 in the morning to 4 in the afternoon. There, our staff are able to they're able to answer your questions and direct you, if you need care, direct you to where you can get that care.
County Executive, you mentioned this in an earlier question, but perhaps you can go into a little bit of detail about is there any funding that's designated to assist the unhoused and those who are living in shelters?
There is money in the budget, and we increased it last year. But that's exactly the kind of thing that we're talking about this week in our budget meeting. And there are emergency funds that the county has. Fortunately, we didn't have to spend a lot of money on salt on the roads this year. So emergencies like that are what we're looking at. And yeah, I know we're running out of time. Are we?
Yeah. One last question. Does people want to know how they can volunteer, what they can do to help? Can they shop for those people who are in quarantine or those who are vulnerable? What's a good way to help?
So, at least for the Office of Emergency Management, we do not take spontaneous volunteers. So if you would like to volunteer, I encourage you to contact the American Red Cross or other affiliated organizations. We work in close contact with such organizations, and we'd be better able to help assign volunteers where they're needed.
Thank you.
I would also add that the Anne Arundel County Community Foundation has put out a call and created a fund for people who want to contribute financially. They give grants to local nonprofit organizations to deal with these crises.
At this time, let's make our closing remarks. County Executive.
Well, yeah, I guess we're going to be doing this again. We're going to be doing this every week. We're going to have different panels of people. We'll probably always have our health officer with us. But I mean, I want to express the pride that I feel in the public servants that we have in Anne Arundel County, in all of our agencies, all of our departments, our school system. It really does, it's an honor to be part of Anne Arundel County government as we're doing this. The commitment everywhere. I have not heard a negative peep from anybody. Everybody is just figuring out how to serve people better. And I have a huge amount of faith in the residents of Anne Arundel County to step up and come together and work together and trust each other to get through this. And we will. We know we will. So that's my main message, and that's what I feel. The questions that people have asked, I know a lot of people did not get their questions answered, and they will be. We have a team of people who's responding, and they'll be responding online to you digitally.
Yes.
Some of those are in our Office of Community Engagement and Constituent Services. When you go to the county website, you can actually log in to get a newsletter from them where they'll keep you informed about this and other things as well. They have a list that they keep. We'll see you next week. We have not scheduled whether it's going to be Saturday or a different day. We're asking people what time works best for them. But I really appreciate everybody's time, and I hope that people are getting something from this, but stay in touch.
Thank you. That concludes our broadcast.